Welcome to Partnering for School Health. This is Michelle Smith. I'm with the Texas Action for Healthy Kids, and this webinar is a partnership between Texas Education Agency, the Texas Department of Agriculture, and the Texas Department of State Health Services, along with Action for Healthy Kids, to bring you information to support coordinated school health. So today we're really excited. We've got a great agenda, and we're going to be starting out with Texas Department of Agriculture, who is going to share information on the new USDA and Texas Department of Agriculture rulings around school food. So I'm going to change presenters here and turn this over to Christina Little Manley. And Christina, if you will show your screen.
Can you see it?
Yes, you're there.
Okay, good morning. My name is Christina, and I work as a nutrition specialist for the Texas Department of Agriculture. My role here at the Department of Agriculture is mainly policy interpretation and helping with training materials, doing presentation for outside groups such as yourself. So we will do a fairly high-level overview of what our new rules are for foods that are sold to our students on a school campus during a school day, and talk briefly about some of the provisions that are in place for the state of Texas in addition to the federal rule. So just an acknowledgement statement that this is a training program, but it doesn't cover the entire scope of the program, and that as a school district you are responsible to know and understand the guidance that is provided. You're welcome to visit our website, squaremeals.org, for more information on Smart Snacks, or the USDA websites on policies for National School Lunch and School Breakfast programs. So nutrition standards for all foods sold in school are part of the Healthy Hunger Free Act of 2010, and that act provided USDA with the authority to establish nutrition standards for foods and beverages sold outside of the federal nutrition programs. So this would apply to any foods that are not part of a reimbursable meal that is provided by your school child nutrition program. It covers any foods that are sold on that school campus and during that school day. So what is the definition of school campus according to USDA? That's any area of the property that's under the jurisdiction of the school district that is accessible to a student during a school day. So the front steps of the school, the lawn of the school, if you have maybe a building that is not connected to your school campus, but the students are allowed to go to during the school day, then that is considered the school campus because it is under the jurisdiction of your school district. What is the school day defined by the federal government is the period from midnight the day before to 30 minutes after the official end of the school day. So if your school day officially ends at 3 o'clock, then the school day period would last until 3:30. That could vary within a district based on the hours of operation of a campus. And so a campus would follow their school day. In other words, if my elementary students get out a little earlier, then on the elementary school campus, we would go 30 minutes after that time, whereas if my high schoolers went till, say, 4 o'clock, we would need to follow the rules until 30 minutes after 4 o'clock on that high school campus. So that can be campus specific. Okay, so I apologize, but my screen is not advancing. There it goes. So what do these guidelines apply to? Any food that is sold on the school campus. So we want to make that very clear that it does not apply to a food that a parent gives a child, and so it doesn't apply to foods given away. It applies to foods that are sold a la carte in the cafeteria. So if your child nutrition department is selling foods that are not part of that reimbursable meal. We call that a la carte sales. They have to meet these standards. If you have a school store, if you have a snack bar at the school, whether it's run by the child nutrition department or run by someone else, anything that's in your vending machines, and fundraising. Again, if your vending machines are not turned on during that school day, then it wouldn't apply, but you would need to make sure that the vending machines were turned off, maybe on a timer or something like that. These rules went into effect July 1st, 2014. So we start out with some just general nutrition standards for all foods that are sold, and they apply to all age grade levels. There's general standards, then there's specific nutrient standards, and then there are beverage standards. So we've got a couple of different groups of standards that we need to look at. So our first specific nutrient standards would be total fat, saturated fat, trans fat, sodium, calories, and then total sugar per item. And then standards for beverages would be vary by grade level, and then identify specific types of beverages that are allowed. They also address container size. So depending on the age of the student, we're going to have maximum serving sizes for beverages. Beverages that are allowed for everyone are water, milk, and 100% juice. And then at our high school, we are allowed to have some maximum serving sizes of 12 ounces and maximum calories of 60 calories per 12 ounce. So this would be a beverage that's not 100% juice, not milk, or not water. Something that might fit into that is some of the sports drinks that the high school students drink. And then if you have a smaller size container, we still need to go with maximum calories, and it works out to be about 5 calories per ounce in the container. Additionally, in the high schools, we can sell some what are determined as calorie-free beverages, meaning that they are less than 5 calories per 8 ounces, or less than 10 calories per 20 ounces. So our calorie-free beverages could be a little bit larger in container size. There is some specific provisions to Texas that we'll talk about that don't allow certain low-calorie beverages to be sold on our high school campuses. The high school students are also allowed to have beverages with caffeine. Elementary and middle schools, then they must have caffeine-free beverages. So coffees and teas would not be allowed at the elementary or middle school, but at the high school they would be allowed. Now, if you have, for example, a small amount of caffeine in a chocolate milk or in a food item at the elementary and middle school, that's fine. What is not being allowed is those caffeinated beverages, only allowed at a high school level. If you're having a fundraiser, then all foods that are sold as a fundraiser on the school campus during the school day must meet those regulatory standards of Smart Snacks. Then they can be sold as long as they meet the standards, again, on the school campus during the school day. Standards for foods do not apply if the item is sold during non-school hours. If my student is taking orders for something that will be delivered to your home or be delivered to be taken home, that would not also need to apply to the standards if we're not going to consume that at school. If you're having an off-campus fundraising event or if you're having a fundraiser on the campus, but it's not during a school day, so on a Saturday morning, for example. And then items, of course, that are non-food items. So a lot of school districts are seeing success with non-food items. One interesting article I read was about a school campus that decided that people really probably didn't need another candle or another tin of nuts, but everybody needed trash bags. And so they had a huge success selling trash bags. I just recently saw a fundraiser for selling mattresses here in Austin. So non-food items, of course, can be sold at any time. And then we need to remember that Texas does not have any exempted fundraisers. So the federal rule said that a state could set a number of exempted fundraisers, meaning you could have a fundraiser that the items the food items did not meet standards. Texas chose not to set a number of exempted fundraisers, thus we default to 0. So again, if you're going to sell food on the school campus during the school hours, then those items must meet the Smart Snack standards. If an item is sold to a non-student, for example, you have a program that sells teachers' meals, and only teachers are allowed to purchase those meals, or adults that are on the campus, then those items would also not need to meet any standards. Who keeps the records? What do we keep? We want to keep purchase receipts. You want to keep those nutrition fact labels. And then if you do not have a nutrition fact label, you can receive sometimes a product specification from the manufacturer. That's going to be typically more something that your child nutrition department would have on hand. Most of the fundraisers and items that you sell, you can get a nutrition facts label. And then who keeps it? The local education authority if they're selling the item, or the child nutrition department if they are selling the item. So whoever is receiving the funds for the item would be who needs to keep the records on the items. And now let's just talk about a couple of provisions that are different for Texas schools. Again, we adopted policies here in Texas that apply to public schools, private schools if they're on the National School Lunch Program, and charter schools. And again, only those schools that participate in National School Lunch and or school breakfast programs would need to follow those guidelines. In our Texas school, we do have a soft drink prohibition. So this would be where those very low-calorie drinks, we would need to be careful about those items. And we define a soft drink as a non-juice carbonated beverage that contains a natural or an artificial sweetener. So a low-calorie soda with an artificial sweetener. Now you can sell carbonated juices, and you can sell carbonated waters with only juices or spices added as flavorings. But again, if they have those artificial or natural sweeteners, they're considered a soft drink. And they may not be sold during the school day to any age grade group of student here in Texas. So that is a provision that is unique to Texas. Then there's also provisions on time and place that were adopted. They were posted to the Texas Register on June 27th. And then we had a comment period, and then they went into effect September 1. There's information on that at Square Meals, but we're going to cover those as well. So these time and place restrictions mirror what we had in place when we were following Texas Public School Nutrition Policy. So on an elementary campus, we may not sell any foods in competition with the reimbursable meal anywhere on the campus during the school day unless it's provided by Child Nutrition Services. So just like in the past, the Child Nutrition Services could sell an item, again, if it meets these nutrition guidelines, but that would prohibit fundraising by a group on the school campus for our elementary students. At the middle or junior high school campus, we may not sell the competitive food anywhere on the school campus from 30 minutes before to 30 minutes after a meal period. So if my breakfast starts at 7, 30 minutes before that. If it ends at 8, 30 minutes after, and the same guidelines for lunch. So again, that can vary based on the hours of meal service on that campus. And again, Child Nutrition Services could sell during that time, but the fundraisers could not happen. Once we've hit the 30 minutes after the meal, then the fundraising could begin in those instances on those middle and junior high school campuses. And then our high school campus may not sell competitive foods during a meal period. So again, whatever is defined as your meal period, or in an area where reimbursable meals are served or consumed. So as long as we're not during a meal period and we're not where that reimbursable meal is sold. So for example, if my high school students are selling down in the theater department, as long as a child cannot take one of those reimbursable meals down there and eat it, then they could have the fundraiser there. But during the meal period, they cannot sell them where a reimbursable meal could be sold or consumed. So that would be an area where you need to define where a student is allowed to take that reimbursable meal in order not to conflict with this provision. And again, the exception to that would be the Child Nutrition Services could sell those items in the area where the reimbursable meal was sold. So again, with time and place restrictions, the school is allowed to revise their local wellness policy and put in their own time and place restrictions. So for the consumption of foods and beverages that are not part of the reimbursable meal. And then that policy needs to be approved by the school board. One thing we want to reiterate here is you cannot go more lenient than the federal rule, which is any item must meet the nutrition standards if it's sold from midnight the night before to 30 minutes after the official end of the school day on that school campus. That's the most lenient you can go. Or you can adopt into your wellness policy, I want to follow the Texas time and place standards, or somewhere in between I want to have a time and place standard. You may want something more restrictive on that elementary school campus, but not on the high school campus. And again, you can always go more restrictive than the federal rule, more restrictive than the state rule. You can never go less restrictive than the federal rule on time and place. Again, the approved wellness policy and minutes documenting the approval should be available during an administrative review by the Texas Department of Agriculture. So if you want to add a provision to your wellness policy, our reviewers would just need to see when that was adopted by the school board, and you would need to keep it on file there at the school. If there is no approved policy within your wellness policy, then you automatically, your school would default to the Texas Department of Agriculture's established time and place restrictions by grade level that we just talked about. So how do you know if an item that you are wanting to sell as a fundraiser would meet, or you're wanting to sell a la carte in the cafeteria? You would use the information that's provided on the item as it's packaged, which is typically a nutrient fact label. And then you can enter the information into the calculator, which is found online. So squaremeals.org, nutrient calculator, or you can merely Google Smart Snacks Calculator, and it will take you to a calculator, walk you through the steps, answering the questions, and it will tell you yes or no your item meets. If you're having some concern with navigating the nutrient calculator, I would contact your Education Service Center's regional child nutrition specialist. They can help you with that, help you to understand how to answer the questions that are being asked on the calculator. And this is just a screenshot from it. So you just go through several steps of answering questions, and then it will tell you yes or no that it meets. You can print that out and attach your nutrient fact labels to that for a nice file to show where you're keeping your documentation. I think one of the things that I've heard some people struggle with when an item doesn't meet, it doesn't tell you why it doesn't meet. So that you could possibly, for example, go look for a lower fat item to sell to replace the item you wanted to sell. If you're finding that an item doesn't meet, again, I would recommend that you contact your Education Service Center nutrition specialist. Sometimes it does matter how you're answering questions within the calculator, and they can help guide you through to make sure you're answering things appropriately and getting the appropriate answer. So again, who can sell items if they meet? Child Nutrition Services, parent organizations, and student organizations. Again, as long as the item meets the Smart Snacks guidelines, it can be sold. And so now I think Michelle wanted me to open it up for questions, and I'll see if I can answer your questions. If we have some questions that seem to be specific to your campus, I would request that maybe I take some contact information and get back to you specifically. Want to try to answer more general questions.
Thanks a lot, Christina. I do have a few questions. If you have a question, if you could please enter them in the question box. We have quite a few people on the call this morning, so if I unmute the phones, it will play havoc with the audio. So the first question is, if a student brings his lunch and brings a Dr. Pepper from home, can he still have his Dr. Pepper in the cafeteria?
Yes, as long as there's not a local policy prohibiting soft drinks. Yes, anything that's brought from home, it does not have to meet any standards. That's a parent's choice.
Okay. Is there any expectation that Texas will choose to set fundraiser exemption days in the future?
You know, we have not heard that will be changed. I would say that in the federal policy, it does not state once you've set that rule that you can't change it. So in other words, I'm assuming that it would be open to being changed if that was what was desired within Texas. But as of presently, we have not heard from our executive team that they will be changing that.
Okay. Who is responsible, or what are the consequences for not meeting these standards, for doing fundraising or things that aren't in compliance?
Okay, I would say that at this point in time, U.S. Department of Agriculture has set the expectation that as our compliance monitors are in school districts, that we will have collaborative compliance with helping school districts to understand how to meet the rules and how to determine if their products meet. There are some more specifics about time and place restrictions that are written into the TAC, or the Texas Administrative Code, and you will find that on Square Meals, but those only relate to Texas provisions. So at this time, the expectation for the federal rules, in other words, what nutrition standards those food items have to meet, that because we are starting a new review cycle, because this is new, that we are to provide guidance and help those school districts to meet the regulations of the rules.
If outside fundraisers are allowed on campus, do they have to follow the same rules?
So I'm assuming you're saying, for example, an outside group is coming in, and it's not a parent organization, it's not a student organization, it's not your child nutrition department. Yes, they would still have to follow the nutrition standards, because the intent of the rule is that all foods that are provided to the student during the school day on the school campus are healthy foods. And so even if it's an outside entity, they would still need to follow those specific standards.
Do you have a slide, Christine, that has your contact information on it?
I possibly, you know, I don't think it's on the first one. No,
sure.
But I can email it to you.
Okay. Or if you can, I'll get you to type it in after we finish with questions. If you can type it into the chat, then people would have it.
I can add a slide right now and pull it back up on my. Want me to do that? I sure will.
Okay. While you're doing that, does Comp Ed funding include all lunch codes, direct certs from our own lunch application? I hope you understand what that means.
Tell me again.
Does Comp Ed funding include all lunch codes, direct certs from our own lunch application?
I cannot answer that question. I'm sorry.
Okay.
I would ask that you get on Square Meals and get the 1-800 number and call in. They can probably give you to somebody in our business operations that could answer that question.
Can you elaborate on the selling of competitive foods at the high school during the lunch hour?
As far as the Texas provisions, then they could sell the competitive foods as long as they met the nutrition standards, and as long as they are not trying to sell those items where the reimbursable meals are sold or consumed. So again, they still have to meet standards, but but they cannot sell those. So that, in other words, they wouldn't be able to sell them in the cafeteria, and they wouldn't be able to sell them anywhere a student is allowed to take that reimbursable meal and eat it. Does that hopefully answer your question?
Okay. How about standards toward athletes? Can other items be sold or provided so athletes won't be hungry before practices?
As long as it was 30 minutes after the end of the school day. So if football practice doesn't start till 4 and you end your school day at 3:30, then at 4 you could provide those items. If you're giving something away, it doesn't have to meet standards. So if the coach, for example, provided the Gatorade, that's part of the program. Every student that's out there participating is allowed to have that Gatorade. It would not need to meet a standard because it's being given away, and the students aren't purchasing it or spending any money to get it.
Okay, so when you say nutrition services, parent organizations and student organizations can sell, but only during restricted time. Is that correct?
Okay, they can sell at any time as long as the item meets those nutrition standards. If the local school district chooses to adopt time and place restrictions as guidance by the federal rule, for example, what we talked about, the school day on the school campus, they are allowed to do that. And that opens up and allows anybody to sell items as long as they meet those nutrition standards. If the local wellness policy does not address a time and place restriction, then we automatically default to those 3 levels that are set in Texas policy.
I've had a couple of questions about the video. We are recording this, and we will post it, and we will send out a link to everyone who registered so that you'll be able to access the video. If the presenters allow, we will also provide a PDF file of their PowerPoint. So we will post those and also send you information on how you can download those. So the 3 days of minimal nutrition MNVs are no longer available.
That's correct.
Yeah,
that's correct. Under Texas Public School Nutrition Policy, we had exemptions for a school district could choose 3 days to have what we call exempted fundraisers, so fundraisers that did not need to meet any standards. And so that is not allowed. Texas set no exemptions, and so we don't have any exempted days. But you are allowed to sell as long as the items meet. And again, if we're talking about school parties where the parents bring the food, all the students in the class are allowed to have the foods at the parties, say your holiday party, your maybe a Valentine's party, an end-of-school party. As long as it is not sold, there's no money that exchanges hands, it doesn't need to meet nutrition standards. So those items given to the student as part of a party, they don't have to meet standards. If you want to sell an item on the school campus, it needs to meet the nutrition standards.
That is, unless there is a district policy in place.
No, a
so
district cannot set exempted fundraiser days.
I mean, as far as giving away food, if the district has a policy for school parties and things.
Yes, that is correct. The local school district can set the guidelines for what they want to be allowed to be given to the students and who is allowed to give that item. That can be a local decision.
Can you elaborate on selling of snacks at elementary campuses?
And I'm assuming we're talking about the Texas time and place standards. If the school district does not adopt their own time and place or does not choose to follow the USDA time and place standards, then an item could not be sold, whether it met the guidelines or not. So the Texas time and place standard says that we're not going to have any foods sold in competition with the items sold by the National School Lunch Program, meaning by your child nutrition department. So the reimbursable meal, and then if they sell snack items, those items always have to meet guidelines as well. The child nutrition department sales.
how much different are these standards from previous standards?
The time and place restriction standards are the same as what was set in Texas Public School Nutrition Policy. The federal standard is a little bit more lenient than the previous Texas policy as far as time and place.
This is an interesting one. Can we use general funds, district funds, to buy competitive foods for students and give them to students as incentives?
The answer to that would be yes. You can't use Child Nutrition Department funds if they came from a reimbursable meal to give items away. But if they have, say for example, they're going to use the general fund and they're going to do an end-of-year pizza party for the students, that would be acceptable. As long as every student is allowed to have the item and no money or no token that they paid for exchanges hands. So there's no sale going on.
Can a district choose to adopt a more stringent policy on birthday parties, etc.?
Yes, they can.
During lunchtime, how many baked chips and cookies can elementary students purchase a la carte? Is there any restriction?
That would be a local decision, and the only restriction on it would be whether or not it met those nutrition standards. So just because an item is baked or a low-fat cookie, they need to make sure that it's meeting those nutrition standards for calories and fat and total sugar, etc. So they would have to make sure it met standards, and then they can make a local policy, for example, that students are allowed to only purchase one snack, or a parent can make that decision through their child nutrition department.
May a district set standards on what types of food can be brought under Lawrence law by a parent or grandparent?
I would refer you back to Lawrence law to make sure that you're not violating any of those items. We always encourage an open dialogue with parents and an understanding of the need at a local level to have control over, for example, maybe somebody bringing something for the entire class. You could have a food allergy. You could have a student that has special dietary needs. And so we encourage that the school board has an open dialogue with their parents and that they do what the parents desire. Some school districts, the parents feel like they don't want any cupcakes, or they don't want something given to their child. And so that needs to be a local decision. And then they just need to be aware of what are the constraints of Lawrence law and what they need to watch for that.
All items in high school snack stores have to meet which standards? No FMNVs?
So they will need, for the standards for foods, across the board, it is the same for all age grade groups as far as total calories, sodium, etc. Now at the high school level, we have a little more leniency in the beverage area, and some of those low calorie beverages we talked about that are not allowed at the lower levels. So as long as they fall within the standards for the beverages and there's no soda as defined by Texas administrative code, then those items could be sold to a high school student.
At elementary levels, can we sell ice cream that meets nutritional standards during the school day? I'm not sure who we would be in this case.
Right. So again, if it's a child nutrition department, yes. We being a parent organization or a student organization, it would be based on what your district has chosen for time and place. Do they want to follow the Texas time and place provision, or do they want to adopt something different, as long as they don't go more lenient than that federal standard? So if it meets, then the next step would be to look at what we have in place for time and place restrictions on that elementary campus.
Okay. Are the nutrition standards more stringent than previous standards when it comes to fat content, calories, etc.?
Previously, there was no federal rule. So in Texas, we had some standards for fat, and we had standards for sugars. We also had standards on specific items that couldn't be sold, like the FMNV, which is a food of minimal nutritional value. Basically, a good example of that would be a gumdrop or a hard candy. The standard is really not more strict, because if you put the nutrition information from one of those foods of minimal nutritional value into the calculator, it wouldn't meet. And so I would say, as far as fat, it's really not. It's about the same percentage of calories. But within Texas, we did have some limits on portion sizes and total fat amount. So it's about the same. When we looked at the old Texas Public School Nutrition Policy, we felt that we were probably ahead of the game in Texas. We'd already started having a dialogue, and we had some restrictions in place about what was sold to the students. But what was adopted by the federal government was kind of an amalgamation of things that other states had done. So it came up being fairly close to what we had been doing in Texas.
Great. I'm going to take just a couple more questions here, and then we're going to move on to our next presenter. If the elementary school wants to reward students with a pizza party, for example, giving honor roll, can they use child nutrition funds? No, they can't use reimbursable meal funds. So there would need to be a paper trail. For example, your child nutrition department may have a catering department that they keep a separate budget on. There's no child nutrition funds that are used within that. And then if the child nutrition department was willing to allow those funds in the general, then that would be. But you have to be very careful with your bookkeeping as far as what your reimbursement is covering. So if you're not making any profit, then that means that your reimbursement from the school lunches and school breakfasts is your budget, and you cannot buy food items and give them away with that. Okay. If a student's lunch period ends at 11:45, can the class have cupcakes for someone's birthday immediately after lunch?
As long as they're not sold, and as long as there's no local policy restricting that.
So far as calorie count example, we give 1 corn dog to elementary and 1 corn dog to a high school student as well. Is that right? I missed the part on calories.
There is a total amount of calories that must be followed if you're selling an item, and that depends on if the item is identified as an entree or a snack. So it does get a little bit more in-depth, detailed-wise. As far as the school lunch program, they have a separate set of standards that they have to meet for a federal reimbursable meal. But as far as total calories, for example, for an entree, a corn dog would be considered an entree. The total amount of calories that are allowed for that entree is the same across the board, no matter what age student we're selling it to.
Can the district make a policy of no birthday parties?
Yes, a district has that local control.
Okay. And then if the superintendent has a meeting with a group of students during lunch, and can he serve pizza if it's paid for by the general fund?
Yes, as long as the students did not have to pay any money to get the pizza, or they didn't have to buy a ticket to go get the pizza, which would be considered an indirect sale. If it's given away, he's allowed to do that.
Okay. Last question, and then we're going to close it off. You have Christina's email there, so you can certainly email her if you have additional questions. Can an elementary campus have a snack sale right after lunchtime?
That would depend on what they adopt for time and place restrictions. If they do not adopt their own time and place restrictions within their wellness policy and it's not approved by the school board, they automatically have to default to those Texas restrictions. And then, again, that fundraiser would not be allowed. Only the child nutrition department would be able to sell those competitive food items.
Thank you, Christina. You've been fabulous answering questions, and that was a great presentation on what can be a very confusing issue. I did have a question. Someone would like to know your position with TDA.
I'm a nutrition specialist. So I interpret policy and then guide our 20 regional ESC nutrition specialists. So each school district could go also to their educational service center. We have nutrition specialists and positions at every one of the service centers, and they can also answer questions.
Thank you again so much for the great information. Now, if I can talk you into switching the screen back to me.
Sure.
Or presenter. Change presenter, then we will get our next presenter, which will be Anita Wheeler, who's going to share information on recess. So Anita, you'll just need to show your screen.
I am about to show it.
Okay, you got it?
Yep.
All right, thank you.
Thanks again, Christina.
Okay, good morning, everyone. My name is Anita Wheeler. I'm with the Department of State Health Services. And as part of our presentation today, I'm going to be presenting information related to recess and how important it is to academic, social, and emotional development. And I think one thing that I want to disclose is the Department of State Health Services received the 1305 grant from the Center for Disease Control, which is a grant that helps support chronic disease prevention, including diabetes, cardiovascular disease, obesity, as well as school health. And so the part of the grant that we are responsible for with the school health program relates to recess and quality PE, as well as nutrition standards in the state. And so we're really happy to be partnering with Texas Action for Healthy Kids and the Texas Department of Agriculture in getting this information out to schools and interested parties, because we know many times we have a lot of parents on our calls, and we're really appreciative of that. So what I'm going to prepare, or what I've prepared today, is an overview of recess, how important it is to academic, social, and emotional development. And as I was putting together this PowerPoint and kind of thinking about what I would tell you today, one thing became very clear to me. Even as adults, we can't sit for very long without needing to get up and stretch and move and get a break. And it's just kind of a normal response. And so I think as I was looking at this, I think I want to promote not only recess for our children in schools, but I think we need to promote recess for us as adults. Many times you'll go to a workshop and you'll hear, you know, a full hour presentation, and you think, oh, I've got to just get up and stretch. And so I think it's really important, because not only is it something that's helping children academically, but physiologically there's really a need to break up your day and to try to get as much physical activity in as you can. So, you know, being a nurse and being a CE person, you know, I always have to put up some learning objectives. And so in doing so, I just came up with a few that seemed to kind of hit what material was there that really was going to be most beneficial to get this talk underway. And it's looking at the Texas Education Code related to the role of the SHACs in making policy recommendations about recess. And I think that's really important, that, you know, we really do a good job of looking at the best evidence, and when we develop a policy recommendation, moving that forward based on the research that's there to back it. We're going to look at two benefits of recess and free play, and as I said earlier, I think all of us need more recess, and we need more physical activity time. And then I'm going to share a lot more than just two, but two resources at least that, you know, you can use, or your local school health advisory council can use, in helping to look at what is the science behind recess. What are the resources that are there that can help us make a quality policy recommendation, and that when you go to your school board, you have some real hard data to share. Now, in reviewing the chapter of the Education Code, this relates to, the specific piece of the code that speaks to what the local SHAC shall do. And as you see bullet 1, it says the local SHAC shall consider policy recommendations for recess. And so as part of your role as a SHAC member, this needs to be a topic that needs to be well researched, thought through, and then a recommendation made to send forward to your school board. And in doing that policy recommendation, the law was very specific. It really said that the SHAC must consider, some research around unstructured and undirected play, the importance of academic and social development as it relates to recess, and then the health benefits of daily recess. And I'm going to go into something a little bit later that the Texas School Health Advisory Council has done to assist the local SHACs in getting some type of recommendation put forward. I'll also discuss some other resources that may be helpful in doing that research piece because, my thinking has always been if somebody's got a good document and good information, let's share it. Let's all, be willing to put it out there. And then, of course, anything that the School Health Advisory Council does at the local level needs to ensure that local and community values are reflected in the recommendation. So I think that's another important piece that we all look at the SHAC as really being the one that looks at this from the local level and makes sure that the local community's values are represented. So when we're looking at recess, there are several extremely good documents. I think one, and I believe I emailed this to Michelle, and it will be available for you after this presentation, is a document by the US Play Coalition. And it really, really gives a breakdown of a lot of the research behind the importance of recess. It really is important that we look at the cognitive, the physical, the social, and the emotional health benefits. There is a lot of information that speak to, the brain function and having some physical activity, but then also looking at the social part of it as well, having children interact with each other in a less structured environment. And I think one thing that was really clear to me in that US Play Coalition article was that because we have our children in all of these different types of formal activities after school, which is great that we are able to do that for our children, there's fewer opportunities for children to play. And I'm going to make my age known here pretty quick. When we were little, we had an opportunity to go out and we would build forts in the trees and we do all these kinds of things, which really helped us develop our imagination. And understandably, society has changed since I was a child and since many of you were children. And so there are a lot of different things that come into play, children's safety, those kinds of things. The fact that many times there's two parents working or it's a single parent family. So there's definitely societal things that come into play here where there's not as much opportunity for children to just play, to just get out and do what children do. The learning that takes place during play, it's amazing. I used to work for early childhood intervention. It's amazing how many things you can teach children just by sitting and playing with them and allowing them to discover different things through what they do naturally. Another factor that really was interesting in much of the reading and much of the literature talks about dealing with stress and how children, because of the way society is now and because all the stress that's put on them by the academic performance piece and by very busy schedules, play really does help children begin to deal with their stress. And it also has been proven to improve test scores, which we all know that the more physical activity you have, the more opportunity you have to do better when it comes time for testing. I just know for myself, when I had to take my comprehensive finals in nursing, I went and took a 30-minute walk before I actually sat down for the test. And it was amazing how much more clear my thinking was, having had a little bit more oxygen put up in the brain. So I think in looking at children, dealing with stress, and then looking at test scores, giving them opportunities to be active really does make a difference. In looking at promoting lifelong physical activity habits, I think one of the things that comes into play here, and no pun intended, is that when children are able to enjoy either being outside and, you know, camping and hiking or whatever, those habits kind of, you know, bleed into adulthood. And so I think sometimes we forget that that physical activity can be fun. And I think having children play, learning the rules of the game, those kinds of things, where it's not so structured, but they actually have to come up with, how are we going to play? What are going to be the rules? And having that kind of opportunity really can go into long-term, not only physical activity habits, but also cognitive types of habits. So understanding process, understanding critical thinking, understanding how to be socially with other people. I think that's another really important thing. And it's really one of those things that when children get together and they start making the rules, you know, there's room for negotiation. There's social interaction that goes on in a non-structured way. And although sometimes you have to watch out for bullying and those kinds of things, many times the children can really create some very interesting games or interesting ways of playing. And I think that's really always an important key part of this, is the creative factor as well. Okay, so looking at some of the research on play, I think the Texas School Health Advisory Council has a policy recommendation document that will, I don't know that I put it in the packet to Michelle, but you can get it on the DSHS website. And what this document really is, it's just basically all of the research on recess kind of put into one little package, although it would not be all-inclusive because we've found a lot more research since this was done. But the primary things that we found, there was a really good article from the Pediatrics Journal that talks about the review of research on and benefits on play, and what happens when children aren't allowed to play. And so I think that's a really good article. There's also a monograph that was done by Robert Wood Johnson Foundation that talks about structured play at recess. So that's a little bit different take on it, where the children are involved in some kind of a structured activity, but yet it's still engaging and it's still helping them understand the importance of getting along and the social interaction as well as the physical interaction. The National Association of Early Childhood Specialists have a position statement, and they really recognize recess as an essential component of education. And as I said before, we as adults can only sit for so long. And I think the same is true. Children learn so much through their play and through their interaction with each other and also with their environment. And so having opportunities where children can have a natural flow of how recess supports that part of the educational component. And then the other thing that this document had, it had recommendations to support policies, professional development, and more research. So it was a really good article, understanding that, you know, it was a bit old. It's in 2002, but when we went back and looked at it, all of the things that were in there are still very, very relevant today. In Education Week, there's research on the linkage of exercise and test scores, and I know that that's a really important component many times in school districts. And so some of the information that was that's been shared shows that there's been a definite decline in the number of school districts that are offering recess, and yet it is one place where there is a direct link between exercise and test scores and even things about behavioral health. Children who may have a hard time sitting still, maybe even those that aren't necessarily diagnosed ADHD, really can have improved behavior just based on, you know, utilizing some of that energy and really being able to get out and move around. The other thing that this article did was it described the impact of physical activity and brain development and how important it is for, you know, physically active folks, you know, young people, children, to have some good physical activity so that we can look at some of that brain development and how it would improve their outcomes. Now, some of the resources, and this by no means is an exhaustive list because this was pretty compact, but there was so much out there. I felt like these were the ones that really, if you had to start someplace, this would be the group of resources I would start with. One of the things, of course, Action for Healthy Kids is a very good partner in promoting nutrition and physical activity and obesity prevention. And one of the things that they have that's available is called Recess for Learning and Recess for Better Health. And this is one document that really kind of gives you an idea of why it's important that children have recess. They recommend 20 minutes a day. And then looking at making sure that the recess is better recess. In other words, there's trained adults out there, there's safety rules in place, there's good facilities, and that it's a physically safe environment for children to partake in recess. And then looking at the different types of recess and playground design, looking at recess before lunch, which goes into the Montana Team Nutrition. However, Action for Healthy Kids does have some information about that. Looking at the recess before lunch from Montana, you know, they really promote this idea that, you know, and there's research to back it up, the children that go to recess before lunch eat a higher quality lunch. There's less waste. There's just so many benefits to it. And so once you get recess, you know, institutionalized in your school, if it's not before lunch, then that would be kind of the next step. But if you don't have recess, then I'd say go ahead and try to get it before lunch anyway, because there definitely is some linkage to the children having a more nutritious meal. And I can remember we had it after lunch, and I think my children had it after lunch. And so they were so wanting to get their lunch consumed, there was a lot of waste. And so I think having it before lunch definitely decreases the likelihood that children will rush through meals and not be appropriately fed before they leave. The Texas School Health Advisory Council has put together a couple documents to assist the local school health advisory, as I said before. One of the documents is the recommendation and research on recess. And so it was just updated in 2014, and it just kind of gives you some background, gives you some recommendations. And then many of the articles that I spoke of earlier in the presentation are actually from that document. The other thing that they've done is they have developed a sample resolution, and pretty much you can fill in the blank, you can modify it as you need to. It's got a lot of whereases, and so you know how that always goes. But I think it's something that's a starting point. It's not meant to be something that you absolutely have to adopt the way it's written, but it's a starting point for you to look at with your School Health Advisory Council to say, do we agree with this? Again, it's meant as a template, and it's meant to assist your district or assist your SHAC in getting something put forward without it being so cumbersome on the local SHAC. The National Association for Sport and Physical Education has a resource brief, and this resource brief really talks to, this would be something really good to use with your superintendent, with your school board members, or with your local SHAC members, because it's a one-pager, and it talks about the physical benefits of recess, the social benefits, the emotional, and the cognitive. And then at the bottom, it gives some NASB resources that you might want to tap into to kind of look at. But it's a really good just one-pager to talk about how recess is important, but it's not so cumbersome a read that people would just put it aside and not want to read it. Again, I talked about the U.S. Play Coalition, and the one article that really came to light for me, the name of the article is A Research-Based Case for Recess, and what it really does is it summarizes what has occurred over the last probably 10 or 20 years as it relates to children and physical activity, and then more importantly, how recess has changed. But then it goes on to talk about all of the different benefits, and it gives a listing of policy recommendations by some of the major organizations. It kind of gives you an idea about how to begin to make a recess policy, and then it's cited with many, many articles. And I sent this to Michelle, and so hopefully it will be some of the information that gets posted. But I think this is one of those articles that if you had to pick one up, this would probably be the one that's the most concise and has as much information about the research. And it was published in November of 2013, so it's a very current document. So at this time, that's what I have right now for the recess piece. I'm open to having any questions that might come my way.
Thanks, Anita. We appreciate that. I don't have any questions right now. If you have any questions, you could just type them in to the question box. That would be great. And Anita has put her information up on the screen as well, so you might want to jot that down if you have questions that come up after the webinar. Here's a question. May a district set standards on what, oh, I'm sorry, that was from the nutrition.
Oh, darn, Michelle, I hope I was going to have a question.
No, I'm not seeing any right now. Oh, wait a minute, hold on. How much time is recommended for free recess time?
Most of the recommendations that I read said 20 minutes. Of course, if you did 20 in the morning and 20 in the afternoon, that would be awesome, but not necessarily doable. So we understand that there are limitations. But I think the important thing is when you do the recess and children have moderate to vigorous physical activity, they really do better in the classroom. So anytime you can put in breaks, even if it isn't the full 20-minute recommendation, even having 10 minutes to get up, stretch their legs, you know, get some physical activity in is still going to show some benefit. But the actual recommendation that we see throughout most of the literature is about 20 minutes.
Okay. Where do we get the one page for the school board which you spoke about? Is that something I have that I will be sending out? Or?
Yes, yes. Michelle, I sent all that to Michelle, and it will be posted.
We will get that out to you. We'll send that out to all of the excuse me, is there any research or data around how many school districts in Texas don't have research?
I would defer that one. I would defer that one to Barney Fudge from TEA. We don't have any of that information that I know of.
Anita, this is Barney, and great job on the presentation. That's great work. And what I wanted to do was follow up on Anita's presentation and state that there isn't anything in law or rule that mandates recess. I get 2 to 3 calls a week because a district isn't offering recess or they're using recess in a form of punishment. And there isn't anything in law or rule that addresses that specifically. That's where it's extremely important for the School Health Advisory Committee. When Anita was talking about 28.004, they're actually the body at the local district level that's given the charge with making those recommendations to the district, because there actually isn't anything in law or rule that specifically addresses recess. And the information that the Texas School Health Advisory Committee has that's out on their website about the policy recommendations for recess. And then I believe that TAFERD, the Texas Association of Health, Physical Education, Recreation, and Dance, they also have some documentation on their website as well about prohibiting recess prohibiting recess as a form of punishment, where kids don't get to participate because they're being disciplined or they have minutes taken away from recess. So there's some documentation there on the TAFERD website as well.
Thank you, Barney.
Okay, is it better to have recess in the morning or in the afternoon?
I think most of the research that I read said before lunch. Before lunch. I could see where there would be a case if, maybe there was heavy-duty testing in the afternoon and you wanted to make sure children had some good physical activity before they went into testing. But most of the research indicates that a before lunch situation really for children does help, especially when it comes to the child nutrition piece of it.
Should PE time should not be considered as recess time, correct?
That is correct.
Okay, because there's there are requirements for physical activity.
Right, it's Barney. And for elementary and middle school, there is a moderate to vigorous physical activity requirement, but where the law addresses elementary school, it states that it's got to be daily, 30 minutes a day of moderate to vigorous physical activity, or 135 minutes per school week, and that can include recess if it's a structured activity. So if it's a structured activity during recess, that can count as part of the moderate to vigorous physical activity requirement for elementary school students.
Perfect. Okay, I think that's our last question. If there are any additional questions, Anita, will you be on for a little while longer?
I will, and I'm going to change the screen back to you.
Okay, and then we will have Barney Fudge from TEA, who's going to talk about physical activity and, oops, I'm sorry, no. I don't think that person wants to be. There we go. All right, Barney, I think it's flipped over to you now. Yep, I see your screen.
Hello, everybody there?
Yeah.
All right. I was having audio difficulties there for a second. Nothing was coming through. Excellent. Good morning, ladies and gentlemen. My name is Barney Fudge, and I'm the statewide coordinator for health education at the Texas Education Agency. And today I was going to take a little bit of time to highlight Fitnessgram and coordinated school health programs. And with Fitnessgram, all the information can be found on the Physical Fitness Assessment Initiative webpage. And I wanted to go ahead and guide everybody right now on what I think is the easiest way to get to that webpage. So if you go to our main homepage and click on the A to Z Index tab at the top, and then click on the letter P as in Paul, and then right here look for PFAI, Physical Fitness Assessment Initiative. That takes you to the homepage. And some of the things that I'd like to highlight are that the system is actually open. The PFAI-Ts and Fitnessgram 10 system actually opened on September 15th. And both systems will close at the end of business on June 12th, 2015 at 5 p.m. And with having two different systems, if your district hasn't upgraded to Fitnessgram 10, and there were funds allocated during the 83rd legislative session that are available that will allow districts to upgrade to Fitnessgram 10 from either 8.6 or 9.3 at no cost to the district, and I'll show you where you can get that information in a second. But if you're using PFAI, so if you're using versions 8.6 or 9.3, you still have to upload your data and information the old way that it's always been done, requesting a TEAS account and then requesting access to the PFAI application, and then that would be how you would submit your data to the agency. If your district has upgraded to Fitnessgram 10 and your student information systems vendor applications have been approved by Human Kinetics, then you can utilize Fitnessgram 10, and the difference between the two is that Fitnessgram 10 is web-based. So once you enter your data into the Fitnessgram 10 system, there isn't any need for you to do anything else. So once you enter your data into Fitnessgram 10, you are finished. There is no need to request a TEAS account, get access to the PFAI application, and then have to do research exports and then upload your data to the agency. So that's really the difference between the two. And again, funds are available through May 31st of 2015 for you to upgrade to Fitnessgram 10. And what happens in the future regarding continued funding obviously is going to be whatever is discussed or what is a result of this upcoming legislative session that starts in January. So we don't know what the future holds at this time until the legislature takes everything to task. So on this web page, if you scroll down to the bottom, there's Getting Started, there's a Fitnessgram Procedures Manual, Frequently Asked Questions, and then the link to the aggregated fitness assessment results. Since law requires districts to report their results to the agency, and we have two different reporting systems, that's why we have PFAI still available, because some districts have opted not to upgrade yet to Fitnessgram 10. So on the aggregate fitness assessment results page, all of the data is there up to the 12-13 or the 12-13 or the 13-14 academic year, or no, the 12-13 academic year. The 13-14 academic year data isn't there yet because the Cooper Institute is actually taking all the data and is performing the analysis on that, and it will probably be middle to late January before we have all of the analysis results available. But in the meantime, I'm working on trying to get the aggregate results that have been reported to the agency. We had roughly around 300 plus districts that reported data to the agency using the PFAI system, so I'm hoping to have that information up where you would just have partial information soon. We're currently going through an agency-wide website transition, which has made things getting posted slightly more challenging than it is just for the normal process. And then the last thing I want to point out is the report generator. You can get campus level specific data by going to the report generator. You would just select your academic year, your campus or district, and then whatever report variables. There's up to 60 or 60 plus report variables that you can select from. So I wanted to let you know that information is available. But on the Getting Started webpage, how to get a TEAS account, information is there. How to upload your data to the agency if you're using versions 8.6 and 9.3, that is also there under the More Information on Getting Started link as well. And then for information on how to upgrade, you would go to fitnessgram.net/Texas. And this is the Human Kinetics website. And if you want to upgrade to Fitnessgram 10, this is where you would need to go to do that. Over here on the left-hand side on the navigation, you would click on the Fitnessgram 10 registration form, and then that's where you would begin your upgrade process right there. And then the other thing that I want to point out is that before you can access the system, your student information systems vendor extract has to be approved by Human Kinetics, or you won't be allowed into the system until your SIS vendor has been approved. And to get information on those vendors, you would just click on Approved Texas SIS Vendors, and that will take you to a page down here at the bottom that gives you information about how or who has been approved as of today. And I do want to point out that if your vendor right here in the red, if your vendor is ITCCS, then you can only use the data extract if your vendor uses both the student and business applications. So if you use one but not the other, then you can't use Fitnessgram 10. You would have to upload your data the old way of doing it. And then for Texas and Skyward, you'll need to contact your vendor support to get instructions from them on how to upload the data using Fitnessgram 10 if your district has upgraded. And with any support questions, you would email support@hkusa.com, or you can call 1-800-747-4457 for technical assistance for Fitnessgram 10. And then the last thing I wanted to talk about are...
Barney, could you repeat that information real quick and I'll type it in? HK what?
It's they can email, and it's on the web page that I have pulled up also. They can email support@hkusa.com, or they can contact or they can call 1-800-747-4457 and select option number 2 for technical assistance and guidance regarding Fitnessgram 10 or how to register for Fitnessgram 10.
Okay, thank you.
And the last thing I want to discuss are coordinated school health programs. And again, if you go to our agency homepage and over on the quick link side on the left-hand side, if you click on health and safety, that pulls up the health and safety page, which we're also currently working on revising all 20+ web pages under health and safety as well. But if you click on the link here on the left-hand side that says Approved Coordinated School Health Programs, that will take you to the Coordinated School Health Programs page. And these are the programs that have currently been reviewed by the review committee that was selected for coordinated school health programs, and these programs have been approved by the commissioner. So these are programs that you would use if you want to use a vendor program. We do have one vendor that we needed additional data from, and that program has been reviewed, and the committee's recommendation has been sent forward to the commissioner's office, and I am waiting on further information from the commissioner's office before I can publicly announce that that program has been approved, as well as 2 district programs. We have 2 districts that submitted programs as well, or 4 districts that submitted programs as well, and I'm also awaiting further information from agency leadership before I can announce or post any information about those programs as well. So that's kind of all that I wanted to highlight and share today. Again, I ask for everybody's patience because there are some of the web pages that I'm responsible for that have some broken links right now at this point in time, because again, it's an entire agency. It's not just me trying to update web pages. It's our whole entire agency that is going through a website transition to a new platform, new format. So it's been a huge undertaking that's been going on for well over a year that hopefully will become final and come to fruition around November or December. So just bear with me if you come across a broken link. Give me a shout, call me, send me an email, let me know. And if it's any information that I have that I can send to you as an attachment, I'm more than happy to be as accommodating as I can. And I'll take any questions.
I have a question. Working for Texas Connections Academy in Houston, any suggestions on how to complete the Fitnessgram in a virtual online schooling option? We're in partnership with Houston ISD. Is this something we need to visit with them about?
Yeah, they would need to visit with their district because even though they are a virtual school, law and rule still does apply to virtual campuses. So they would need to visit with probably the director or coordinator for health and physical education for Houston ISD. I want to say I can't remember her last name, but I think her first name is Felicia. So that's where they would need to start first.
If our district upgraded to Fitnessgram 10, is there a way to get Fitnessgram data for a school from last school year, 13-14, if the PE teacher at that school did not save a hard copy of the data?
Well, so how did they submit their, I would need to know how they submitted their data. So did they just recently upgrade, or did they upgrade last year and input the data into Fitnessgram 10?
Yeah. I would say probably they should contact you directly on that.
Yeah, they probably need to just give me a call or shoot me an email, because if they upgraded to Fitnessgram 10 last year and input the data into Fitnessgram 10, then they should be able to log in and run a report and access that data. If they used version 8.6 or 9.3 last year to enter the data, then they can go in and check that report themselves by logging into TEAS, accessing the PFAI application, and can go to either the report generator or click on a link that says uploaded data summary, and then they can review those results themselves.
Okay. Who in the district is responsible for submitting the report and upgrading the program?
Typically, that is the IT person that would fill out the registration form to upgrade, because the IT folks are generally those people that work with the student information systems vendors and assist in getting those extracts approved. So that's probably the person that would be responsible, but if for further guidance, they would need to contact Human Kinetics.
Are there new requirements or mandates by House Bill 5 that impact SHACs or coordinated school health?
Well, there were some new things that came about in legislation, not particularly by House Bill 5. I mean, House Bill 5 had the community and student engagement, and part of that was health and physical education. So obviously, your coordinated school health programs, your SHAC, Fitnessgram results, those kinds of things would all go into play in designing whatever your rating scale was, because all of that was a local district decision. The law and rule both were very explicit in saying that the agency shall not have any involvement in that at all. So that's a local district decision on how they're going to do that. But changes to 28.004 were made last legislative session, where now, and going along with Anita's presentation, a SHAC must have a physical fitness and physical activity or physical fitness, physical planning subcommittee now as part of the SHAC. And then also SHACs need to look at using joint use agreements with other community service organizations, because oftentimes when you get out into more of the rural, extremely rural areas of Texas, the facilities at the school are the only thing that the community really has. So entering into community memorandums of understanding or joint use agreements was also added to 28.004, and if a district does implement any kind of joint use agreement, then that also needs to consider the insurance safety purposes, as well as, I believe it says, be part of the report that is given to the board at the end of each school year.
There's one more question, and I will open this up to you or Anita. How would we go about getting a grant to help initiate a program like CATCH, which is one of the approved coordinated school health programs?
Yeah, there's federal funds that are out there. I'm trying to think of any PEP grants, Fiscal Education Program grants. I believe there's one called the Carolyn M. White. Anita, is that correct? Or the Carol M. White?
Yes, that's the PEP grant.
Yeah.
Yeah, and I mean, there's federal monies that are out there. The NFL Play 60 has grant programs. The Carol M. White federal grant program is out there. There would just need to be some research. I believe there's the Friday Beat, which is something that is sent out by Department of State Health and Human Services school health programs. The Friday Beat, I want to say, has some grant opportunities that are also listed in there from time to time as well that districts can look at and utilize.
Another thing we're doing, Barney, is that we have a funding alert. And what that funding alert is really focused on is obesity prevention initiatives. And so you may be able to get some funding out of there, maybe not specifically to putting in just curriculum, but kind of a broader approach to obesity prevention. And so that document, you can get to it from the DSHS website. And it's a funding alert. We're putting it out 3 times a year, and we're really going in and looking at primarily obesity prevention, cardiovascular disease, and diabetes. So that's probably one of those things that if the audience would get on our website, they could sign up for that, and that alert comes out 3 times a year.
And the other thing, Michelle, with coordinated school health programs and their curriculum, districts can use their instructional materials allotment also to purchase or to assist in helping offset the cost for purchasing those materials.
Okay. All right. I'm sure we could talk some more, but we have one more presentation and we have about 30 minutes left. So we will have more information next month, I'm sure, from Barney, and additional opportunities to ask questions. I know there's interest by some districts in creating their own coordinated school health program as opposed to using one that's been approved, and that's a whole different process. So we may try to have someone explain how that works in a future webinar.
And if anybody has any other questions and we don't have time to get back to them at the end, they can shoot me an email, and my email address is william.fudge@tea.state.tx.us.
And I am putting that in the chat box, so you will be getting that momentarily. Okay. So I think the screen has been flipped back to me. Let me just show my screen. Good morning. Again, Michelle Smith. I'm the state coordinator for Texas Action for Healthy Kids, and I'm going to give you a brief overview of school health advisory councils. For the last year, we started about November of last year, these organizations have all been working together on creating materials and information and resources for school health advisory councils. We have had in the past a lot of support for SHACs through the Department of State Health Services and their regional service center coordinators, but that's not available now. So we decided, as all these different organizations working together, that we would like to be able to fill that void. So over the past year, we have worked to develop resources, and one of our partners, It's Time Texas, has developed a page for collaboration to house information and resources, and you will see that, you should see that link on the bottom of the slides. I will also provide that at the end if it's not showing up, which I don't see it right now. So what exactly is a School Health Advisory Council, or SHAC? We call them SHACs. They came about via the Texas legislature about 10 years ago, and they were originally formed to deal with health education, specifically sex ed, parents, to make sure that parents and communities had input into what was being shared for sex education across the state. They have become so much more. They've evolved over time, and people don't even remember that much anymore because there are so many other things that School Advisory Councils have been asked to deal with as they've progressed. A SHAC is mandated by law. Every district in the state should have a School Health Advisory Council. It's a district level. A lot of times it gets confusing because sometimes the campuses have what they're calling School Health Advisory Councils, and that's great. We really want each campus to have one of those or have a wellness team. But a SHAC is something that's mandated at the district level to work on all the different things that involve student health. And it's a way for parents and the community to have a voice in what happens at the schools, and it's also a great way excuse me, to share the importance of health to academics with the school districts and the school board. They are mandated to review all health-related curriculum, and that does include things that are now online. We've had some things in Austin regarding online curriculum, and that is also under the purview of the School Advisory Council. So we won't be able to go through all the laws this morning. Barney mentioned some of it, and I'll probably mention a few more. But then we also have the different laws and timelines and a lot of good information posted on that website. Who should be a member of the School Advisory Council? The law mandates that a majority of parents of students who are not employed by the district. So it's not that we don't want parents who work for the district involved in School Advisory Councils, but the intent was to make sure that all parents were part of this, and that there was a good input from all the community, not just people that work for the district. For some reason, my control panel has decided to pop up. There we go. Other people that you might want to consider to put on your School Advisory Council would be students, school administrators are very helpful, law enforcement, the faith community can be very helpful, mental health professionals, healthcare professionals. Those are all people who, anybody who has an interest in school health or in a child's health would be helpful to have on your School Advisory Council. The benefit of School Advisory Council is the fact that they make that connection between health and academics that Anita mentioned earlier. The whole approach to education now has to involve the whole child. You're not just sending a brain to school to learn, you're sending a whole child. And if that child is tired or undernourished or not fit, they're not going to be able to learn. And it's as important to the teachers and schools as it is to the parents that this child be healthy and this child be ready to learn. It puts a little more emphasis by having the School Advisory Council on having a healthy school community. Your members can be a credible collective voice for supporting healthy youth and children in health activities, and it facilitates getting parents involved in matters that are around school health, and then it also makes sure, as we mentioned earlier, that family and community needs are met. as we all know, a lot of the issues that students have now are behavior-based issues, and that makes it essential that we have an organized effort to help address these issues, whether it's about poor nutrition, if it's about bullying, or if it's about alcohol and drug use. All of these different behavioral issues should and can be addressed through your school health advisory council. So what exactly is the law? Let's test what you know. Since I'm on a webinar, we can't do this as we would if we were presenting it live, but you can just test yourself. Is the chair or the chair or the co-chair of the School Health Advisory Council must be a parent? This is true. To make sure that there's enough parent input and parent engagement, the legislature mandated that either the chair, or if you have a chair that is not a parent, you can have a co-chair who is a parent for the School Health Advisory Council. SHACs are required for each individual campus. I think you can get this one right because we just talked about this. That's false. SHACs are not required for each campus. They are required for each district. SHACs must report to the school board at least once annually. This is true. School Health Advisory Councils report directly to the school board. This can be in writing, or it can be a presentation to the board. In our school district, we have asked to be at least address the school board once a year so that they know who we are and know how important school health is, and we think it's really essential. While if we send them written documents, it's great, but having that presence in front of them once a year is very helpful. SHACs must meet at least 4 times annually. This is also true. School Health Advisory Councils, we found over the time that they were meeting like once a year, and there's just not a whole lot you can do if you're only meeting once a year. So the legislature now mandates that SHACs must meet at least 4 times a year. And I see that the website is listed on these slides, so the website is www.itstimetexas.org/SHAC. SHAC must be comprised of at least 5 members appointed by the school board. This is true. You can have as many members as you like, but you have to have at least 5 members. And if you have 5 members, then 3 of those members need to be parents who are not working for the school district. And these members all are appointed by the school board. That doesn't mean that the school board has to find members. You can have a committee that can make recommendations to the school board on members, but they do need to be approved or appointed by the school board. The majority of the members must be staff employed by the school district. You know that one is false. The majority of the members must be parents who are not employees of the school district. SHAC recommendations must be considered by the superintendent before changing a district's curriculum. This may be a little bit confusing, but that's false. The SHAC makes recommendations to the school board. The process that we recommend is that the SHAC develop the recommendations, they take them to the school administration, superintendent, and make the recommendations known to the superintendent. The superintendent does not have to approve those. They still will be presented to the school board, and then the school board takes them into consideration. So it's up to the school board whether or not those recommendations move forward. But like I said, it is really probably not a good idea to make recommendations without vetting them with the school board. As Barney mentioned earlier, there were some new mandates that came out of the last session, and one was the development of the subcommittee for physical activity and fitness planning. So this is, the way our SHAC and Austin ISD works, we have a committee for each, or a subcommittee for each of the coordinated school health components. And so we feel like it's important to cover all of the different components of coordinated school health. But the legislature wanted to make sure that physical activity and fitness planning was being considered, and try to encourage school districts to find new and better ways to keep kids physically active, not necessarily always relying on PE classes. So the new subcommittee that was formed is to help make policy recommendations for how to increase physical activity and improve fitness among students during the school day. Other recommendations that School Advisory Council need to be working on are the number of hours of health education, things that relate to other prevention of obesity, type 2 diabetes, mental health concerns, of course, human sexuality instruction, which we talked about earlier. And then as Barney mentioned, it's really important that we work in collaboration with the community and look at joint use agreements and other ways that the school district and communities can work together to improve student health. And then, of course, as Anita spent a lot of time on, it is under the purview of the School Advisory Council to make recommendations about recess for elementary school students. And that's not just the amount of time spent on recess, but also whether recess can be used as punishment or, you know, other things that relate to recess. The district SHAC can make recommendations to the school district regarding all the different aspects of recess. We mentioned coordinated school health, and something that SHACs were designated to do was to make a recommendation on a coordinated school health program. So Barney shared the programs that have been approved. The School Advisory Council, if your school district is not currently implementing a coordinated school health program, the School Advisory Council should review and make a recommendation on which one should be approved. This was supposed to be done several years back, but you know, things move slowly sometimes, and your district may not have actually implemented a coordinated school health program. So if that's the case, the School Advisory Council could review the programs that are approved. You can ask the organizations to come in and make presentations and then make a recommendation to the district on which one should be accepted. This is a new model that was created by CDC and ASCD around coordinated school health. For many years, we've had 8 components of school health. Now we actually have 10, and it's been expanded so that we can better explain to the education side why health is so important. This model aligns with the model and structure objectives of education, and is showcased by expanding the components, focusing additional attention on social and emotional climate, which is new for schools and classroom environment, and then the pivotal role of community involvement. If you notice, we've added community around the outside to show the community involvement plays in the growth and development of our youth. So you'll be seeing more and hearing more about the whole child, whole community, whole school approach to coordinated school health. We have worked also over the last year to develop and share different tools. And one of the things that can be helpful to your School Advisory Council is this tool, which can help you establishing priorities. We have developed this document, and it's posted on that website, and it's based on the School Health Index. So we've identified the 8 components and several different options that you could look at, and you can see if your school is doing in these areas. If this is something that you feel is very serious, it's something that's already in place, or if this is something that should be considered. And score the different issue areas, and then you can have a discussion on which areas you feel your SHAC should be working on. Under nutrition services, we've listed healthy vending policies, policies on parties and fundraising, universal breakfast, discouraging food as a reward. When we did this presentation at one school district, their concern was hunger and making sure that kids were getting food either during the week or even on the weekend. So they wanted their School Advisory Council to address that, and that's where they put their focus. This is not to limit SHACs on what they should be discussing, but more to just jumpstart you on what things you could be considering. We've also put a set of criteria to help you with prioritizing issues as you're thinking through things. How many people are affected? In their case, they felt more people were affected by hunger than would be affected by some of the other issues they could talk about. And what is the seriousness of the issue? You know, how is it going to impact people? Is this something that is been going on for a long time? Is this something that's just cropping up? Is it something that's already getting better, or is it actually getting worse? What is the equity involved? Are there more than one group? Is it specific to a certain group? Then what type of strategies are there out there? And is this something that your community is really going to resonate with your community? I know in some cases, if you're looking at nutrition, in some cases they're more interested in school meals and less interested in vending. So you want to look at what your community is going to care about and start there. That's not to say that you don't eventually work on all the issues, but it's really helpful when you're working with a SHAC to come up with the things that most people are going to have a buy-in to first, and then put the tougher issues on after you've had some successes. You also need to make sure that there are resources available, and is there funding available? Are there individuals and groups available that can work with you on this? And then, is this really an issue, or is this more of a symptom? A lot of times we spend time working on symptoms and then not really addressing the root cause on things, so that's something else to consider. So this is one of the forms that's on the website that you could download to help you with your SHAC. Anita mentioned the TSHAC, and they have some great documents to help school health advisory councils. The TSHAC self-assessment tool can help you determine if your SHAC is proceeding as it should, meeting its objectives. It's kind of it's a self-assessment of the processes that you go through to help you determine, where you might need to do some work, and you can work through this with your school advisory council. The report to the board, if you're not sure what exactly that should include, the TSHAC has come up with a template for that, so that you can customize this PowerPoint template, and then it'll give you instructions on how you can use that to make your annual report to the board. And then the last thing, the TSHAC also has some research and recommendations for offering physical activity outside the school day is one of the documents they have. Again, they have information on recess, and they have information on the current legislative requirements for basically all 8 components of coordinated school health. So all this information is on the TSHAC website. We also have a list of other resources that can be helpful to your school health advisory council. These will be listed on a resource page on our website that we mentioned earlier. Barney showed you some of the information on Texas Education Agency. There's also a link to the laws and the rules, square meals. Christine Manley mentioned that, and there's information there on the nutrition. There's a School Health Advisory Council guide, which DSHS is in the process of updating, and that guide is a great resource on all of the particulars on developing a School Health Advisory Council. There's an organization called NASD that has a policy database on school health, so that's a good place to go if your SHAC is interested in developing policies. The CDC has a great webpage on coordinated school health, and a lot of good resources there if you need more information specifically on coordinated school health. There is an organization called CSPI, and they have a lot of good information on nutrition things. They have information on healthy food fundraisers or healthy fundraisers that aren't non-food fundraisers, healthy vending options, things like that. And then, of course, when you get to assessment, there are several different assessment tools. Actually, Healthy Kids has some information and tools on their website. CDC has the School Health Index, which is the gold standard for school assessments, and that is all online now, so you can go online to do that. So all of these resources will be on a document that is posted on the PeaceTimeTexas.org/SHAC, which is the website that's right here. I am always available if you have questions and need additional information, or if I don't have it, I can certainly point you in the right direction. So I hope this has been helpful. I know that excuse me, it's been pretty quick, but if your school or your district is interested in some training, you can go to the itstimetexas.org/SHAC webpage and request training. We're planning to try to do some regional trainings. We're also working on some webinars specifically on School Health Advisory Councils. We have about a 3-hour training that we delivered Anita Wheeler delivered over the summer in several different locations. So we want to make sure that we can support these SHACs, because we do feel that that is one of the most important ways to have parents engaged and to accomplish a lot of the things that need to be done to make our schools healthy learning environments. So I'm going to check here on questions. And we will, I guess you're going to have to just bear with me a minute. Okay, we will send the links out for the recorded versions and also post the information that Anita has provided, as well as the PowerPoint within the next week. If a district chooses to not have a local requirement for high school kids to take a health course, what components of health education must be included in other parts of the student education, and where would these be included? Barney, I think that's in your court.
Yes, ma'am.
Do you have an answer for that?
I mean, health is no longer a requirement for graduation. Districts can choose to offer that at the local level, but in requirements for health education, you of course have the parenting paternity awareness training that often, if you're offering health instruction at the high school level, then the PAPA curriculum also needs to be taught there as well. Previous not the 83rd but the 82nd legislative session, there were texts added to the Texas Essential Knowledge and Skills for physical education. There were bullying texts that were added, so then that's also something that is part of the physical education requirement. And then alcohol awareness education programs also are part of what is required to be taught during health education. And I am just popping this off the top of my head right now. I mean, that's all I can think of off the top of my head. I'm trying to pull up law and rules right now.
Are the health teaks posted on the TEA website?
Yes, ma'am. If they go to the curriculum webpage, they can get to the Texas Essential Knowledge and Skills for Health Education there.
Okay, and there was a question about all school districts, SHACs, are supposed to now have a physical activity and fitness planning subcommittee. That's yes, true. That is not the TSHAC, that is the districts. Each district is now required to have a physical activity fitness planning subcommittee at the district level, yes. If a coordinated school health activity is covered by a PE or health TEAC, may it be considered as covered and no need to duplicate? Barney?
I mean, law and rules specifically state that a district has to implement a coordinated school health program. So whatever is in that coordinated school health program that is in their curriculum is what would need to be taught, and how that curriculum is implemented throughout the course of the educational day is a local district decision.
Okay. As a parent chair, how do you assess all the necessary information to be effective? As a parent chair individually, that would be really difficult. You really need to have a good, strong group of parents and community members as part of the School Health Advisory Council. Ours is set up where we have a steering committee, and on the steering committee, we have individual committee members for the different groups. So we have one for mental health and social emotional well-being. We have one for physical activity. And together, we work with all these different subcommittees, and they reach out in the community for content specialists. So our subcommittees may have people who are not members of the School Health Advisory Council, but are content members. So they are better equipped to be able to make good recommendations to the School Health Advisory Council. And the chair is the facilitator. The chair really doesn't have to decide RSS by themselves. You can bring in tools, you can bring in content experts, and then you allow the Scope Advisory Council as a group to determine what direction they would like to take or what resources or information they may need. And that's where some of the resources that we've posted online can be helpful to you. What 2 components of the 8 components have been divided to make 10? Will there be a location to explain what each of those new components will encompass? You should be able to find additional information on the CDC website since they work on this model. The 2 components that were split were parents and communities. It was family and community involvement, and now I believe it's family and community as 2 separate components. And then social, emotional, and mental health or the environment were, I believe, split as well. Are coordinated school health programs considered unfunded, and how is the school supposed to pay for it? They are quite costly. Yes, they're an unfunded mandate. Barney, do you want to talk about that at all?
Sorry, Michelle, say that again. I'm still researching the previous question to continue to find more information.
Okay.
Say that again.
Are coordinated school health programs considered unfunded, and how is the school supposed to pay for it? They're quite costly.
Yes, there is no funding to pay for coordinated school health curriculum, but that's where Anita and I were talking earlier about some of those grants that are out there that districts could apply for that could offset some of that expense. And then also a district can use their instructional materials allotment to offset some of the expense as well for coordinated school health programs.
Okay. This one's also for you, Barney. If health is offered in the high school online, a computer class, does the PAPA curriculum still have to be taught?
My answer to that would be yes. Again, if a district is going to offer health education as a local credit, then the PAPA curriculum must be taught.
Is the PAPA curriculum required if they are not offering health?
If they are not offering health, then no, a district would not need to teach that, but some districts cover that by offering it in their like social sciences maybe, and then I'm trying to think of CTE program. I'm drawing a blank, like FCCLA programs. And I apologize. I'm not trying to offend anybody, but I'm showing my age now, where courses used to be called, homemaking or home economics, but they're not called that anymore. I can't think. Thank you very much. Thank you.
Consumer science.
Thank you
Family
for
and
coming.
consumer science. Yeah.
Thank you for coming to the rescue. Family and consumer sciences. I do know that some districts incorporate it that way if they're not offering health education. When I was at the service center level as a school health specialist, there were oftentimes family and consumer science teachers that were actually coming to the PAPA trainings that were being hosted at the service center because the district didn't offer health, so they were trying to incorporate it through that route.
Are there specific alcohol awareness programs that TEA recommends?
There is a website. If they go to the health education homepage on TEA's website, there is a link there for alcohol education programs, and again, there's no funding attached to that as well, but there's a list of programs that have been researched and reviewed and looked at that were posted there to meet meet that statutory requirement.
Okay, one more question, and we're on the hour here. Is the same true for bullying and alcohol awareness as far as if you're not having a health education class, do you need to teach those?
Yes, ma'am. I mean the TEKS. You know, if you look at it's Texas Education Code 28.002 subsection P for the PAPA, and I think they plan that P for PAPA. Side joke there. And then subsection R for alcohol education, and then subsection S for the bullying text. So that's where you can find that in law. In 28.002, you know, does talk about what is the required curriculum. So I mean, if they're not offering health for local credit, then they need to find a way to incorporate that somehow.
And I believe CPR is also required. So even if you're not teaching health, don't they still have to? Yes,
CPR. This past legislative session, instruction for students in grades 7 through 12 was also put into law and rule, and implementation would begin with this year's junior class. It is a local district decision if they want to try to catch this year's seniors. There is nothing in law or rule that says this year's seniors have to be trained, but the rule specifically states that implementation would begin with this year's junior class. Students must receive the instruction at least once before graduation, and there's nothing in law or rule that says how to document it or how to track it. It's a local district decision when it comes to that. Some school districts are adding this to a student's transcript, which is also a local district decision if they choose to do that. But it has to be students have to, in grades 7 through 12, have to receive instruction at least once before they graduate, and you begin with this year's junior class.
Anita or Barney, any other comments? We are at the top of the hour. Actually, we're 2 minutes past.
Well, I did to talk about the instructional materials allotment. As long as the school district can back up that the request that they're submitting for disbursement, for the disbursement request, as long as they can back up that the request has something to do with student learning, then that's acceptable to submit. So what the district would need to do is get with their district textbook coordinator to fill out the disbursement request and enter information in all required fields, and then submit the request for approval for financial assistance for coordinated school health programs.
I think this has been a very informative webinar. Anita, did you have any other comments you want to make?
I guess for our part of this, we will be begin to focus in on finding some really good presenters on the quality physical education piece. We're going to be working with Tayford. So if you all have some ideas of presenters that you know have really implemented quality PE programs and would like to share those folks with us so that we can get them on a webinar in the future, we'd be more than happy to take it and speak with them, because I think, you know, the whole physical activity piece, we have some really great physical educators in our state, and we want to really showcase them.
And we will be working on getting more information out on school advisory councils and trying to support anybody in all the school districts in their efforts there as well. Barney, any parting words?
I don't have any.
All right. Well, we are going to officially close the webinar, and stay tuned. There will be additional webinars in the spring, so you will be getting information on those as we go. Oh, actually, there's another one on November 5th. How can I skip right over that? We will be sending out information on November 5th webinar, probably early next week, so save that date. Thanks, everyone, for attending.
Thank you. You all have a great week.